Welcome back. I want to talk to you guys today about the windows of transference of trauma. And so we've talked a little bit about adverse childhood events, or what we would call ACE, or experiences, adverse childhood experiences. You might hear term both of those. And then also PTSD, so post-traumatic stress disorder. And so in the literature and the research, we actually see that adverse childhood events or experiences is equivalent to PTSD. And so I think that this is really important for people to know. I've sat with many different individuals over time where there was a significant trauma in their childhood and they never had thought about it as being PTSD. We just didn't have those terms back then, right? And so I've had many people who are in their 60s and 70s and something very significant happened to them. Maybe they were in foster families, maybe they had a parent who passed away, maybe they were in an orphanage, those kinds of things. Maybe they also I have a number of patients that I see that were adopted for really difficult beginnings in life due to drug addiction or substance use disorder by their parents, their birth parents. And so those things can really make a difference, right? On the DNA, we understand that very clearly about what certain drugs can do to the DNA. But again, going into adverse childhood events that maybe are later on in one's life, maybe 5 years old, 8 years old, 12 years old, like we notice that individuals, when a trauma occurs, we talked about this earlier, makes a big difference. So for example, in the research, kids, specifically males, that were in pre-puberty, basically, if there was a significant trauma that happened then, they did not fare as well as they would have as they had been at a different age. And so this is where we recognize that traumas that occur at a very vulnerable time, specifically around hormone changes, right, and neurotransmitters or brain chemical changes, can make such a difference in the outcomes of our health, for good or for maybe not as good. And so I just want to share again that ACE can be seen in the research to be equivalent to PTSD. And the reason this is so important is we know that from the research with PTSD that this is where really that's the window of change that happens. So, or the portal or the window or even the doorway that opens up that lineage to where basically those traumas can be then imprinted if it has not been resolved. So PTSD, you'll see in the literature and the research, is really the big kind of thing that we're looking for when we talk about these lineage imprints, that is where, when it's unreconciled, those chemicals, those hormones are communicating this ongoing pattern of stranger danger or fight or flight. And then it is passed on. And so what we see within this research and literature are amazing, beautiful things related to when people finally recognize that there's something that they want to tend to, that they want to try to fix and heal. They're tired of the nightmares. They're tired of basically the waking up and being in drenching sweats. They're tired of feeling that, you know, everything that they turn around to, they might hear a noise in the background and it's very scary for them. And they're in the middle of some type of, you know, supermarket or store, and all of a sudden they're having a panic attack. And so they want to get more support. And this is where it becomes really beautiful, because if you've had PTSD, and we think about a lot of the research in our military, we have lots and lots of research how trauma, PTSD specifically, is really that doorway. Again, we all have trauma that happens within our life, most of us, right? The research is on that. But the difference is PTSD is one of those that you can't really reconcile. And you have a lot of those symptoms, you have a lot of those side effects, and also symptoms that are coming up that are very concerning, right? And so the body is still sending that message. So it serves as an opportunity, even though it may seem like it is torturous. It's actually, I want people to realize that it's an opportunity to heal. It's an opportunity, an invitation each time to be like, hey, listen, this needs to be resolved. The body really is not trying to traumatize us, even though it can feel like that. It's really trying to serve as an informer of that library. Again, remember, recognize that the body can hold amazing information within this repository or library, and it wants to be cleared. And so in our next videos, I want to talk a little bit about PTSD in our military, but I really wanted to set the stage of, trauma is one thing, right? And a lot of people, they get over it. That's not what we're talking about here. We're talking about trauma that is not reconciled, and it becomes something like a PTSD or adverse childhood events where we just can't quite clear that. So we're going to talk about the folks that are most impacted related to PTSD and some of the science that's out there and what we can do to help clear that. Stay tuned.